Hi, my name is Kristen Aubrey, and my presentation is on my study regarding the intensive management of diabetes for preventing further complications from the disease. So a synopsis of the article that I found, this was a study performed by the National Institute of Diabetes and Digestive and Kidney Diseases to show how keeping blood glucose levels as controlled as possible could slow the progression or even the onset of possible complications or damage associated with diabetes, such as diseases like kidney damage or kidney failure, which would put a patient on dialysis or cause death, eye damage called diabetic retinopathy, and also nerve damage called diabetic neuropathy, which is one of the leading causes of amputations in diabetic patients. This research study was performed over a period of 10 years from 1983 to 1993. There were 1,441 volunteers who participated in the study, with ages ranging from 13 to 39 years old. All of these volunteers picked for the study had a diagnosis of type 1 diabetes. Some requirements of the study were that the patient had to at least have a diagnosis of diabetes type 1 for 1 year, but they couldn't have had the diagnosis for more than 15 years. All of the volunteers in the study were picked to either have intensive glucose control or just standard glucose control. The hypothesis under investigation wasn't directly stated in the study, but from reading the research, I gathered that the hypothesis was what was the effect of the standard control of blood glucose versus the intensive control of blood glucose on the complications of diabetes. So the methods for this study, for the purposes of the study, intensive control of diabetes meant keeping the participants' hemoglobin A1C levels as close to or ideal to the ideal normal of 6% or less. So if you don't know, the hemoglobin A1C is the average blood glucose of a person over a 2 to 3 month period. The A1C test is a blood test that provides information about a person's average blood glucose levels, also called blood sugar, over the past 3 months. The A1C test is called the hemoglobin A1C, or otherwise known as the glycohemoglobin test. The A1C test is the primary test used for diabetes management, diabetes diagnosis, and in diabetes research. Components of intense glucose management include testing the blood glucose 4 to 5 times a day, injecting insulin at least 3 times a day, or utilizing the use of an insulin pump, adjusting insulin doses according to intake and exercise. So, of course, if somebody exercises more, their body is using up more sugar, pulling sugar for energy, and so you would require less insulin if you're exercising. Um, the patients also had to follow a diet and exercise plan and make monthly visits to their healthcare professional that were composed of a physician, a nurse, an educator, a dietitian, and a behavioral therapist. The volunteers were randomly assigned to either the intense or the standard control group. So results of this study, the results show that there was a decrease in the onset and the progression of diabetes complications for the participants in the intensive control group. The research proved the hypothesis to be true, which was the effect of the standard control of blood glucose versus the intensive control of blood glucose vital in preventing complications of diabetes. So yes, hypothesis is correct. When it came to the complications of eye disease, otherwise known as diabetic retinopathy, in the intensive group, the results show a 76% reduced risk, which is huge. Progression slowed down by 54% in participants who were already experiencing some degree of eye damage prior to the study. 24,000 people with diabetes lose their eyesight every year to diabetic retinopathy, and it's a leading cause of blindness in adults over the age of 65. In regards to the kidney disease as a complication from diabetes, the study showed that in the intensive group, there was a decrease of 50% reduced risk in developing nephropathy. Diabetic nephropathy is the leading cause of kidney failure in the United States, and currently, so after 15 years, a third of diabetics will develop kidney disease, and these patients either have to go on dialysis permanently or until they receive a kidney transplant if they are put into a kidney transplant program, which is not always guaranteed. Other comorbidities affect a patient's ability to be put on the transplant list. The risk of developing or having diabetic neuropathy become worse, and there was a reduced risk of 60% in the intensive therapy group in this study. Diabetic neuropathy causes pain and loss of sensation or feeling in the feet, legs, and the fingertips. This complication is a major contributing factor to why leg and foot amputations are so prevalent in the diabetic population. This complication can also affect the nervous system's ability to control blood pressure, heart rate, sexual function, and also digestion. So a reason why I chose this study, I chose to review it because it was interesting, informative, it was very clearly written, and because I work with diabetic patients and also dialysis patients who are mostly on dialysis because of their diabetes, I really thought that this was interesting, and it kind of crossed over with everything that I do at work every day, and it was really informative to me. Diabetes is a major issue in America. According to a 2014 report by the CDC, 29.1 million people in the United States currently have diabetes. I thought that this study was interesting and confirmed so many things that I've studied and been taught about the progression and the complications of diabetes and how we can prevent them. So some of the strengths that I found in this study were it identified so many ways that we can reduce the risks and the complications associated with diabetes to increase quality of life in our patients, which is huge. More than 10 years after the study, patients who were in the intensive control group maintained that intensive control, and they persisted, and the long-term effects were very prevalent in those populations. The limitations that I found associated with this study, there are also a lot of cardiovascular risks associated with diabetes, and the 10-year study wasn't long enough to really measure those effects, but a benefit to that limitation. In 2005, they did another study that showed a 42% decrease in the risk of cardiovascular disease in this population. And this was done by the same researchers who conducted the first study. It was actually a later part of the study. Another limitation is that it didn't study intensive therapy in young children, which are mostly the people who are going to be diagnosed with type 1 diabetes. It also didn't study patients who already had severe complications, maybe because they were already kind of too far gone, and at that point there was really nothing we could do to reverse those severe complications. Also, it did not study patients who had frequent hypoglycemic episodes, because intensive control could further antagonize those hypoglycemic episodes. And it also did not study patients who already had a limited life expectancy, which I think is pretty self-explanatory. Intensive management doubles the cost of managing diabetes, which makes sense because you're having more frequent visits to the primary healthcare provider and your healthcare team, and also you're having to increase your costs by doing more frequent blood sugar testing at home. So you have to buy more supplies, more lancets, more glucometer strips. So that's the reason for that. Another benefit that I found, though, related to that limitation is that the cost is so much more offset by the risk of, by decreasing the risk of complications. You're going to have a decreased cost of related to those complications, decrease medical expenses, and the quality of life that you're going to receive by having tighter glucose control and taking charge and controlling your diabetes, that is going to be a huge benefit that is going to offset the risk. So that completes my presentation. My name is Kristen Aubrey, and I hope you enjoyed. Thank you.